what we have done is put together a youth mobile clinic, which provides 2 social workers as well as 1 nurse, in addition to our own mental health professionals that are in the schools to support our students.
The clinic goes to students and kids where the need is. So we're bringing that team on site instead of asking kids to get a referral to go elsewhere.
Kind of like a one-stop shop. We're working with the existing mental health workers that they have, which are fabulous, and the CYWs as well. So we're kind of we're taking a team approach.
And so we felt there would be a tremendous value in bringing together social workers with a primary care nursing angle as well to co-locate on site in schools.
Sometimes there can be barriers or struggles getting families into the program, so it's removing all barriers of that and having it physically at the schools, so they're able to access our services very easily and quickly.
The team is really integrating into the school community, really focused on trying to be friendly faces, getting to meet the students, creating a comfort level, trying to create a safe space in a space that students already feel safe in.
And it is a comfortable place to access that support, and when students are in class and they're able to learn, they're able to feel mentally well.
I think there's been a concerted effort to create a buzz around it and to introduce the program into the school without it being, the stigma of mental health attached to it. We've worked really hard in our building to create a system of support. It's served our student demographic very well.
It's important for students to start learning about this as they're young, so they don't have more problems when they're kind of older and they get more used to talking about it.
So having access to professionals in our school could potentially reduce that wait time for families to get the service that they need. They can do a more extensive risk assessment with our students and then determine the best approach and where that student should go next.
Out in the community, there tends to be a lot of wait lists and things like that, and here you can kind of just visit and there's peers around, there's people that you know. Instead of going to a brand new place, a location where you haven't been, this is a familiar setting.
You don't need an appointment, although we will be happy to facilitate appointment. This is where the partnerships with the school are critical. So appointments can be made by the school-based team, or the students can just walk into the clinic and receive care.
So we can help kids out with any sort of crisis assessments and safety planning. If kids are struggling with anxiety, stress, low mood, relationships, any sort of challenge or problem, mental health or physical health wise.
We can talk about tough topics like suicide. We can talk about things like problems with addictions. We can talk about complex family matters that are happening at home, and we're here to provide that support in a single session. And if you need more than that, we can connect you directly to the programs that exist in this community for you.
On the primary care side, we're also dealing not just with the mental health, but the physical health of these individuals. So by virtue of this mobile clinic, we can connect kids to primary care. We can do point of care testing on site if it's needed.
The nice part is with the nurse that's there, it now can bridge into some, if a student has medical questions or medical needs, there is a bridge directly to an RN. So not only do we have the social worker and the mental health side, but we also have the medical side with the nurse here.
So the nursing role, we can still address physical needs as well as mental health needs, and we can kind of address what's going on, support them in any way I can. I can do like vital signs, physical assessments, a lot of education as well, and then make referrals to any community partners that the kids may need.
We know that investing in early prevention, and that's education, awareness. Sometimes it's building strategies around, concepts like resilience, even sort of being able to, when we think about mental health, identifying how you're feeling, articulating that, being able to do that in those early phases really does sort of prevent us from seeing more chronic issues, seeing, things along the lifespan, such as substance use, harm.
In a general sense, we're seeing some anxiety, some low moods. Maybe there's things going on at home, maybe they're struggling with school and it's affecting their mental health overall. A lot of kids just want to have conversations, somebody they can trust.
So dealing, very particularly focused on some of those higher risk things like suicide ideation, self-harm, and then some of the very common things that we see in particular in that secondary school population, anxiety and depression, providing options for students to get help when they feel that they need it.
We do have bigger problems right now in our society. We have social media, we have family conflict, we have employment issues. There's so many big problems that students are trying to navigate that they need help with that. And I think that's why we have to do, we're doing a great job, but we have to always continue to see what can we do better to help with mental health literacy, and that it's okay to say I'm not okay.
There's a lot of cyberbullying and bullying that's going along right now. It's also students are starting to struggle with like work imbalance, with so much work and so much other things to do that the pressure's starting to like make them think too hard about different things.
So it's looking at all the complexities of what teenagers are, who, right? They've always been complex, we know that. But we're hoping that by, again, bringing a program like this into the school, that we're just giving them greater access to be able to talk about those things.
Our main goal is to help the students so that we can get them back to class. We want to alleviate any time away from academic learning that we can, and get the support that the student needs, but also we're at school. We want them to learn academically.
And if there are ways that we can come up with strategies and safety plans to keep students in school while also supporting some of those greater mental health needs, we know the wellness of that student, is likely to improve.
And when they come to school and they're accessing the type of support that they need and they're able to feel better about their mental health, they're able to go back into the classroom and learn better.
We are seeing the benefits of it. We are seeing that students are able to access the support. Parents are calling for support. So we just want to continue that. And by expanding to a couple different schools, I think we will continue to grow this program. It would be great to continue to grow this so that we have more of these mobile clinics.
I think probably every school in a perfect world would have access to something like this, but really wanting to focus on those most at need.
So far, it's had some really great feedback. Students are feeling comfortable. Students feel comfortable with, coming down to the office, requesting a support. So it gives them their own autonomy and their own resilience capabilities to get the support that they need if they're not receiving that elsewhere.
I think it's definitely a valuable service. It's helping to improve the kindness, and it's improving the overall climate of the school.
I think kids seeing our faces around and knowing that we're here, knowing that we're here to help, right? So making it a safe place as well as, setting them up for success with their mental health. They trust us, they feel like it's a good service, and they get what they need out of it.
We have 2 more years of funding for this project. It took us a little bit of time in year 1 to get it to conceptualize it, get the right partners at the table, and then launch it. And now we have 2 years to grow, sustain, and build the evidence base to secure funding in perpetuity for it, which will be very important and critical to the community.
I love this. I think that this is something that will be greatly utilized. It's not just something that would fit in our building here, but it is something that would be of benefit to many, many of our schools. I can't, it's already done so many good things this past year. I can't wait to see what having those supports in a regular way will look like in the coming school years. I hope it's a model that's here to stay.